muscle that we're going to work on is going to be the hamstring. Sometimes we want to alter the hamstring length by changing the position of our pelvis. Your patient might start to compensate by having their pelvis shift, and you might see the opposite leg come up. To be able to keep our hands free, we just place a towel right over the opposite leg, proximal to the patella. If it's on the patella and on that kneecap, it starts to compress it. It might be uncomfortable for them. So the main thing is just the placement of the towel roll. From that position, I'm going to take my patient's leg, and you can start with the knee flexed or the knee straight. I prefer the knee straight, and I'm just going to slowly bring them into an extended position. So making sure that my patient is breathing, comfortable, and at the level of my shoulder, I can switch out and keep this knee in a nice extended position with both of my hands placed proximal to the patella. For this stretch, it'll be 30 to 60 seconds. It is passive, and I want to go through her full available range. And so I'm feeling a little bit of tension right there. Dr. Dickerson, are you doing all right?
Yes.
Do you feel the stretch?
Yes.
Where do you feel the stretch?
In the back.
So that's exactly where I want for the hamstring muscle. If I wanted to bias a certain hamstring, I could also consider internal rotation or abduction if I wanted to have the lateral hamstring, or I could do an external rotation and abduction if I wanted to do the medial hamstring. Again, because of the tissues being in that tight position, I'm going to come very slowly out of the stretch and allow for my patient to come down to the resting position. Okay.